Hi, my name is Dr. Gorman. Today I want to talk a little bit about torticollis. We actually see a lot of infants and kids in our practice, and it's an interesting thing for me. My original background was in sports medicine, and I actually worked in a physical therapy clinic for a few years before getting into chiropractic. And there's a whole story to that, but I remember vividly working in the physical therapy clinic. And someone saying to me, hey, my baby has some issues with colic and with torticollis. Someone said we should bring him to a chiropractor. Now, the funny thing was, I remember this was almost 25 years ago. And I vividly remember and feel the emotion like it was yesterday. Like I got filled with anger, and I literally said, any chiropractor that adjusts a baby should be in jail. And the funny thing was, I look back at that and I go, well, why would I have said that? Where did that come from, right? I didn't have any training on it, didn't know anything about it, didn't even know anything about chiropractic back then. But to me, the idea of someone taking a baby or an infant's head and doing some kind of a fast adjustment to the neck did not sound like a good idea at all. And so part of the reason why I did this video and why we end up seeing so many kids is, and it's near and dear to my heart now, is because of the fact that I got to see, like, that's what a lot of parents, especially dads, might think when they go, hey, we're going to bring our child for, whether it's for GERD and acid reflux and colic and all these things, and they go, why would I bring them to their chiropractor? And so I just want to talk a little bit about why that is, especially knowing my background and how I was completely against it. It wasn't that I was against it or I was dogmatic about it, I just didn't know. And so that's the whole point of all the videos and all the educational things that we're out there trying to do. We try to promote what we call common sense health. We get you to hear different things that we talk about and then use your common sense and say, does it make sense that you put an infant on two weeks old, 4 weeks old, 6 weeks old on a medication for certain things without trying other things, right? You have to answer that for yourself. I'm not here to tell you whether that makes sense or not. But I am here to tell you that we get great results with torticollis, and here's why. As we know, the birth process is extremely stressful, and the average obstetrician is pulling with anywhere, some of the studies talk about between 50, 60, 70 pounds of pressure on the head, and it can vary whether it's a C-section or vaginal. But as they're pulling on the head, the neck, as we know, is very fragile, and as they pull, it's very common for some of the bones in the neck to become misaligned, or what we call in chiropractic, subluxated. And so as those things go out of alignment, they literally will pinch some of those nerves and affect the communication from the brain, which controls everything, to the rest of the body. So if the upper neck is out of alignment, it can affect, and does affect, a whole bunch of different muscles in the neck, which affects torticollis. The torticollis is when the head gets stuck to one side or the other. And so our goal is to do very gentle adjustments, about the same pressure it would take to feel ripeness in a tomato, 1 to 2 pounds of pressure. Most parents, when I do it, don't even know I'm adjusting because I'm doing it so gently that they can barely tell, but we're feeling for where it's out of alignment, putting some gentle pressure and putting it back in alignment. We've also got a number of videos on our website of me actually adjusting babies. Some of them actually sleep right through the treatment. They came in asleep. So it's a great example of how gentle that is. But there's a couple things aside from the nerves in the muscles in the neck that get affected, and we gently remove that to get the correct signals going there. There's a couple of cranial nerves that are in the back of the head. In particular, cranial nerve 10 is the vagus nerve, and that exits out of the bottom of the skull there, and that can be affected when either the head is oddly shaped, which could be from part of the birth process itself or just from normal pregnancy part, or it can actually be, and that nerve, cranial nerve 10, is the vagus nerve, that actually comes down and affects all digestion and breathing and different things like that. So that can be a common cause for gas problems and GI problems, things like that respond well. But in torticollis case, we're also working a lot on what's called cranial nerve 11, which is called the spinal accessory nerve, and where that nerve exits, it's very common. So we do some very gentle molding of the cranium. We're certified what's called cranial sacral therapy, and we can mold that to try to reshape that so that there's the pressure off take the pressure off the nerve so the right signals go there. That nerve goes to two muscles in the neck. It goes to your upper trapezius muscle up here, which has a lot to do with head turning in infants or adults, and a muscle, the big muscle here that you can see on me, called the sternocleidomastoid, or the SCM. And that has a lot to do with head turning. So if one of those sides don't get the signal and it doesn't work on one side, then the other side has nothing opposing it, and it will pull it to the side. So by us doing some gentle techniques to the muscles and doing some gentle things to the upper neck and to the head, we're able to restore that normal integrity and help dramatically with a number of different things, but in particular with torticollis. So you have to ask yourself, does that explanation of anatomy and physiology make sense to you? To me, it doesn't make a lot of sense without starting there. To start, sometimes they'll put a big helmet on, they'll do a lot of stretching and things, and all those things can be helpful at times. However, we want to start to go after the root cause, which is the hallmark of our practice, and go after that initial nerve interference first. So for more information on that or other things, please visit our website, www.gorman-health.com.